Thank you for taking the time. Can you introduce yourself and tell us about where you work and what you do?
Yeah, sure. Joanne Peter. I am the Director of Innovation at Jhpiego. Jhpiego it's an international nonprofit organization focused on global health, and we're affiliated with Johns Hopkins University in the US. And so, as the Director of Innovation, I oversee the innovation practice of the organization. We're around 36 to 40 country offices at any time working in global health around the world. And so that's a large number of people and lots of great ideas coming out of the organization. And so I oversee that innovation practice out of Cape Town in South Africa. I've had a very multidisciplinary background, actually. So, I started in medicine. I studied as a doctor in South Africa. I worked briefly as a doctor in the South African health system. So I kind of gathered a bit of that. Then I did my master's in international development. And so I moved from health to development. And then I found myself at Google, which was, another hop across into technology and innovation. So that nexus between health, development, technology, innovation, that's where I've now spent my whole career. So after Google, where I was at google.org, so I was both giving grants away, but also working on social impact focused products and with cross-disciplinary teams. I then went to a program called MAMA. It was the Mobile Alliance for Maternal Action. So that was to use mobile phones to share pregnancy, parenting information to moms in low resource settings. We're talking early days of SMS. No one had smartphones, but we were trying to reach mothers in India, South Africa, Bangladesh, Nigeria with this important information. And so I worked on that for quite a long time. And in fact, one of the projects I worked on became Mom Connect, which was this really big scaled South African government initiative, which has reached now 5 million mothers with this important information. And then I went in-house to J&J and I led their digital health investments for quite some time. So I worked with a number of stakeholders there, helped to start their Center for Health Worker Innovation. And then I decided I'd done enough funding for a while. And so I came across to Jhpiego so I could be on the implementation side again. Now, trying to implement health innovations.
From your experience, what are the biggest barriers healthcare organizations face when adopting new technologies? And how can structured innovation programs help overcome them?
Yeah, so this is a good question. I think you have to look quite systematically across the whole kind of innovation life cycle. So one of the first things I think is actually even identifying what their needs are, precisely identifying what their needs are so that any solution that's introduced can actually solve those problems. So like a problem exploration phase to really get very concrete on what the needs are. I'd say that's probably the first thing, really defining what they actually need. And the second thing is maybe knowing what's out there and then making a smart choice. So there's a huge amount of potential innovation that's out there, and it's very hard to decide how to choose one thing versus another. And so having some sort of a structured and systematic process with criteria to understand what the right solution might be. Then financing, sustainable financing. So in my world, in particular, the nonprofit world, particularly if you're working with national governments, you may be working with health facilities that are in a low resource setting, understanding what the financing might be to be able to support any introduction of any innovation over time. And then there's also like the broader ecosystem around that solution. So where we see a lot of challenges arise is when people are very excited about a particular technology innovation, for example, they try to introduce it, but they miss what the maybe regulatory or policy environment might be in that particular country, and they hit upon all sorts of roadblocks because they didn't think about the full ecosystem. So I'll give you a quick example there. We were trying to really look at e-pharmacy as a new route for delivery of family planning and also of post-exposure and pre-exposure prophylaxis for HIV. So e-pharmacy, great, new solution we wanted to explore. Unfortunately, before you can give prophylaxis for HIV, you need to say that someone's HIV negative. And the policy in Kenya, we were trying this in Kenya, was that the HIV test had to be done by a health worker. So you're trying to introduce an e-pharmacy solution so that people don't have to go into the health facility, but actually they have to go into the health facility because they need a test to be done by the health worker. So we actually had to change the policy first to say that you could do an HIV self-test before you could open up that innovation. So it's just like sometimes a blind spot around some of the broader policy and regulatory issues that have to be explored. And then I would also say kind of change management with users. And in our case, so users often in our case being health workers, and then clients, so often patients or communities. So, barriers around them being interested in using the solution. How's it making their lives better? What are the trade-offs for them? What are the losses they might be experiencing when this solution is introduced? So an innovation practice, I think, helps you to think pretty systematically around all of those potential barriers, and not just come in halfway through without having considered very carefully that kind of full continuum from identifying the problem through to introducing the solution, and making sure that you don't then, hit upon some unexpected pitfalls along the way.
Great. So we recently ran a survey and learned that only 31.8% of employees who have participated in a hackathon have ever seen ideas successfully implemented into their company's roadmap. How do you ensure that through healthcare innovation efforts, whether hackathons or other long-term projects, lead to real-world implementation rather than remaining theoretical exercises?
Yeah, so it's actually, I'm a bit of a hackathon skeptic, I'll say. I think they do have their time and place, but the survey results probably hold true with my own experience of hackathons. They can generate a lot of buzz and excitement, but they're not necessarily go anywhere. I was reflecting on this. So I always remember this little mantra, which says that your impact is a function of your idea and your implementation. So you can have the best idea in the world, but without the implementation, you don't get the impact. You can have not a great idea, like an okay idea, but unbelievable implementation, and you'll actually get better impact than if you had a brilliant idea but no one to follow it through. So the challenge with hackathons is that often the ideas are coming from all of these excited individuals, but they don't have any stake in the implementation of that idea afterwards. And so the rubber hits the road when you actually have to take this idea and make it real. I mean, we just discussed that in the last question. So I would say it's about making sure that the people who are involved in generating these ideas, they also have a stake in the implementation of the ideas afterwards. So a nice kind of multidisciplinary group of actors, but those who are going to see this through for the long term. And so we generally don't do hackathons so much as slightly longer term projects that are rooted in real world problems that actually come with some financing. So there's some resources to see it through. And that have leadership buy-in and that actually have stakeholder relationships. So we try to make sure that all of those parameters are in place so that there is actually the likelihood of some real implementation, not just the ideas.
Yep. Yeah, and we're seeing that as well with other interviewees, like having not just the idea and the event or the long-term thing, but having the whole plan. If your idea gets picked, here's how it gets funded, or here's how here's the plan to see it come to fruition. So that makes sense.
Yeah, exactly.
Okay, your organization has taken a structured approach to innovation through initiatives like Catalyst Fund, Jhpiego Stars, and Jhpiego Wish. What inspired the creation of these programs, and how have they shaped the way innovation happens within your organization?
Yeah, well, let me tell you what they are. So the Catalyst Fund is our internal R&D fund. So every year, if we have the resources, we do have an open call for ideas within the organization. So across all of our country offices, responding, as I said, to real world problems that they are experiencing in the projects that they're trying to implement. And then we select around 6 to 8 of those, and we invest in them, generally around $80,000 to $100,000. So it's a decent size investment over about 8 to 10 months to actually work on that project. And then out of those, we see a lot of very exciting proof of concepts that emerge, many of which can then actually be implemented in those projects, or which can result in new funding, new partnerships, new publications, evidence, etc. So that's Catalyst. Jhpiego Stars is more of an appreciation acknowledgement program of just organic innovation that's bubbling up within the organization. So it doesn't come with funding. It's more of an acknowledgement program. So again, we'll ask for who is doing stuff that's awesome. And it helps from a knowledge management perspective, it helps other offices to get inspired by ideas that other offices have had. And it helps to create that culture of innovation within the organization, that this is something that we notice, something that we celebrate, something that we call out. And then Jhpiego Wish, so that is an accelerator program. So that works with external innovators. So we're a big international nonprofit, and we have a lot of internal capabilities, a lot of internal innovation and ideas, but we recognize that most of the innovation comes from outside of our walls. Lots of the innovation comes from much smaller local organizations, grassroots innovators. But we have this platform, this like global footprint. We have access to a lot of resources. We have connections with Ministry of Health, Ministry of ICT, etc. And so we can be a scaling partner. We also just have a lot of know-how on how to actually introduce and scale innovations that we can impart to these smaller innovators. So Wish works with, it's over 100 innovators now around the world that have great solutions, and it gives them advisory services. It helps them to kind of amplify their work through our platforms. It looks for ways where they can demonstrate their projects within our larger projects so that we can serve as a scaling partner. So kind of across that spectrum, we're doing an emphasis on internal, but also an emphasis on the external innovation, trying to keep a finger on the pulse of what's out there and trying to find ways to bring that innovation into our organization.
Great. Yeah. So specifically with the Catalyst Fund providing funding for proof of concept development and Jhpiego Wish supporting startups in emerging markets, how do you ensure these programs lead to meaningful, scalable healthcare solutions rather than one-off experiments or kind of just little blips?
Yeah, I mean, I think the first thing I would say there is sometimes there will be one-off little blips. And that's okay. It's an innovation practice. So if you want absolutely everything to be a runaway success, well, then I think you're probably setting the bar a little bit too high, not taking enough risk. As an innovation practice, you have to know that some things are going to work and some things are not going to work as much. And the main thing is that you have to learn from why it didn't work. So as long as you try to understand why didn't it work, you learn something from that, you can do something differently next time. It's not a failure. It's part of running an innovation practice. So that's the first point that I would say there. I would say with our internal work, success comes in lots of different ways, and the longevity of the work can come in lots of different ways as well. So it may be that we get a publication out of it. So we actually designed it in a structured experimental design in order to be able to say, this worked or didn't work. And now we don't continue that particular project, but we got a really strong research publication that shows that this thing works or doesn't work in this context. And then other people can take and use that beyond even just our organization. And that would be a kind of success. Or maybe we'll test a new partnership and we will see a great partner, not such a great partner. And that's a very useful piece of learning for us to get, and we can turn that into a longer term partnership over time. Or maybe we spin it into new funding, right? So we do a little proof of concept, and then from there, we're able to now make the case with a larger donor. We've got some runs on the board. There's something here to look at. Can you help us to take the next step? And so we'll get new business, new investment on the basis of that Catalyst Fund. So that's how we take those and turn them into something more meaningful. And then with Wish, I would just say very rigorous selection. So we have very rigorous criteria. We publicize our calls as widely as we can. We have internal and external selection committees. We do a lot of due diligence. So we do very rigorous selection if we're the ones who are actually doing the selection. Or other times we work with innovators that have actually already been selected by other donors, and they're just asking for us to help accelerate those solutions, provide them with support, in which case they already have investment, they already have donor relationships, and so they've got some pathway there.
Yep. So earlier you gave the example, and it sounded like there's so many stakeholders that have to help you with innovating within healthcare. So healthcare innovation, obviously, it requires collaboration across many stakeholders. How do you create environments where clinicians, technologists, administrators, government, they can co-create solutions effectively?
Yeah, that was the e-pharmacy example, I guess, that I gave earlier, where it required government stakeholders, it required clients and their preferences, technologists, health workers, and there were a lot of interesting vested interests in there. So if we refer back to that example, we spoke about the fact that they were moving from HIV tests done by health workers to HIV self-tests. Health workers didn't necessarily like that move because their role has to change. And so you can get a lot of pushback if you don't engage adequately upfront. So I would say trust is probably the number one thing that is required. So to create environments of trust. And so that's where our organization has been working in many countries for decades. So we've been around for 50 years. You look at Nigeria, we've been there since the 70s. In a lot of countries, we've been there for a very long time. We've been implementing with ministries of health in health facilities for a really long time. So they know us. And so that trusted relationship is very, very important. You can sometimes play that role of being a bit of an honest broker between those stakeholders and then some of the newer innovators that are trying to introduce their solutions and helping to broker those relationships of trust. So I would say, long-standing relationships and trust. I would also say being a multidisciplinary team yourself helps. So if you have within your team some people who can wear that hat of clinician versus the administrator versus the technologist, and you can understand and have some authentic appreciation of those different perspectives and vantage points, that helps. So I always encourage everyone, try to get multidisciplinary yourself as much as you can. And then lastly, I think I would say skilled facilitation. So actually having people on your team who have real training and track record in skilled facilitation so that they can take those conversations and navigate them carefully using really good facilitation techniques to guide those conversations. I would say all three of those things are really useful. And the advantage of the skilled facilitation is it also builds the trust, right? It makes sure that people all have an experience where they feel heard, acknowledged, appreciated. It's a positive experience for everybody.
Great. Next one. Many healthcare organizations struggle to measure the ROI of their innovation initiatives. What key success metrics should leaders track to ensure their innovation programs deliver tangible value?
Yeah, thanks. Good question. I think I touched on some of this earlier. So one of the first things that we're trying to do, as I said, is create a culture of innovation. So actually just participation across the organization in our innovation work is something that we can track very easily and that we do appreciate. So how many people applied to the Catalyst Fund? How many people applied to Jhpiego Stars? How many people signed up to be judges? How much did they bring their expertise in selecting the winners? So what's the kind of overall organizational participation in these efforts? Because that speaks a lot to how much everybody values these, and they feel that they have a stake in what comes out of it, and they feel that their idea has a chance of being supported. So that's one of the things that I would definitely track. Then, as I said, we look across evidence that's created and learning that comes out, partnerships that are tested and created, and then new business. We look across all of those things. So it may not be that we are immediately able to turn this into new business right away. So into a new donation, a new project right away. But it might help us to get implementation track record in a new area that we're trying to break into. So an example there would be, we're very well known in maternal and child health, but we weren't necessarily as well known in newborn health. And so we really wanted to get into the space of small and sick newborn care. And so that was a strategic priority for the organization. So we put out in our call, can we look for innovation in the area of small and sick newborn care? So great ideas that came through that we were able to invest in. That will give us now implementation track record in the space of small and sick newborn care and new partnerships in that space that we've been able to invest in using our own R&D funds. Next time we speak to other prospective supporters or partners, we've got that track record. That's one of the returns on investment that we value, is new track record in an area that we're trying to break into that is strategically important for our organization. New partnerships, as I mentioned. So those could be smaller innovators. Those could also be new government stakeholders, but that this innovation investment allows us to open up those new partnerships. And then, communications material. So it could be publications, actually academic publications if we're able. But even if it's conference presentations or posters or it's thought leadership posts, but this innovation practice gives us content that we can use for communications materials, which help us with positioning in this new space. So all of those things are positive wins that come out of these investments. And we've had some very good successes. So particularly in new emerging areas, like in AI, for example, we wanted some implementation track record in that space. So we made like a little internal investment in doing some AI supported risk segmentation of HIV positive clients in Nigeria. So we wanted to see who's more likely to drop off of their treatment versus others, who's going to stay in treatment and who's going to fall out. And we built with a partner a machine learning model to do that in Nigeria, invested ourselves, built the model using our own investment, and then we're able to kind of parlay that into a new donor investment to be able to test that out with a much more rigorous experimental design. Saw great results. Yes, it worked. We actually reduced interruptions in treatment using that model. Now we've just got a renewal for that partnership, and we're in conversations to scale that up even further with others. So nice little pathway there.
Great. And that's a segue to the next question, which is looking ahead. What role do you see AI and automation playing in the next generation of healthcare innovation? And how should organizations prepare for this shift?
Yeah, so it's going to be everywhere, in everything. So I was looking at some stats and I saw, Africa has 24% of the global disease burden. It has 3% of the global health workforce, and it has 1% of the global health financing. So the numbers just don't add up, right? You cannot solve that with business as usual. It is not going to work. You have to do things differently. And so you absolutely have to deliver healthcare in ways that do not rely on health workers the way we imagine health workers, and in very, very cost-effective ways. And so at every level, we are using AI now. We're using AI to create training materials for health workers so that health workers can be trained more swiftly, using all sorts of multimedia content that's been supported by AI. We're using AI to mentor health workers so that you need fewer mentors to be able to support health workers to deliver high quality services. We're using AI, as I said, to target which clients need additional attention so that health workers can spread their very scarce time across those higher risk patients. We're using AI for bots that are now providing counseling so that you don't need to have human health workers that are providing that counseling on family planning or whatever it is. So we're just using AI for forecasting, early warning systems. Where are disease outbreaks going to happen? Where are you going to have a supply chain stock out? So everywhere you look, it's being used to try to allow us to take those very scarce resources and distribute them more effectively, because we have to, else we're never going to solve the problems that we need to solve with the status quo.
Is there anything else that you would like to share or discuss related to innovation within healthcare?
I guess only that healthcare has been such a laggard, honestly. It's such a incredibly regulated space. It's a space where people are really emphasizing quality, of course, and the client's experience. So it's been a real laggard. But when I look at all the ways that technology and innovation have disrupted other industries to make them just so much more seamless and client-centered and connected and decentralized. I mean, all of those opportunities exist for healthcare too, so that it's out of brick and mortar facilities, so it's much more client-centered, not siloed into different disease areas. There's much more convenient. I mean, you should be able to experience healthcare in a way that surprises and delights you in the same way as you're surprised and delighted in other industries all the time by the way that technology anticipates your needs and meets you right where you are in your own home. So it's coming. It's been slow, but I mean, I think the opportunity is there, and we've just got to, keep at it.
Cool. Well, thank you so much for taking the time.